The Gauteng Coronavirus Command Council has revealed that while hospitalisations are currently lower compared to the same position in other waves, there is a shift in the age group that's being hospitalised with the coronavirus. More people under the age of 40 are getting admitted to hospital. Gauteng is currently the epicentre of the pandemic in our country. Yesterday, the province accounted for more than 70% of the 8,500 new cases. The rise in cases has been driven by the Omicron variant.
So what you see in the graph there is that we are going to be seeing a quick, fast rise of numbers still this week and probably the next, and we should peak round about the second week of December. Now, one can argue, well, the peak is coming very fast. It's natural because we have high levels of transmission, but it's very important to bear in mind that a peak of a wave, a peak of a resurgence, is not the end of a resurgence, because if you see the predictions there, we're going to have high levels of community transmission still into January. So this means that the fact that the peak is coming earlier should not prevent us from going and get vaccinated. We're going to have very large numbers still past the new year in January.
Well, the editor-in-chief of the Vaccination Centre for Health Journalism, Mia Malan, joins us now with more on this. Mia, good afternoon to you. So Gauteng has a high number of new cases. Hospitalisations not as high as there had been. There's, I suppose, a decoupling might be the word, a disconnection between the number of cases and the number of hospitalisations. We have a new variant. That many people have been vaccinated. When we put it all together, what can we predict about what's going to happen?
So important to note that the data that we have is still very early data, especially that what was presented this morning. But what modelers think, as you've heard there, is that round about the second week of December, we may see a peak and then still a high number of cases being transmitted in Gauteng specifically until mid-January. So the second week of December peak is only in Gauteng. But what we are also seeing is that there are higher proportions of younger people of younger than 40 being admitted to hospitals. And experts think that could be an indication that vaccinations are working pretty well, because if we look at who has gotten vaccinated in South Africa, people of 60 and plus, we round about 60% of them that have received at least one shot. If we look at people between 18 and 34, it's only about a quarter of them that have received one shot. So experts think the reason why we're seeing higher proportions of younger people being admitted in Gauteng is because their vaccination rates are so much lower.
That's really interesting. I mean, it's still important. It's very important right now to get vaccinated.
Absolutely. That's your only defense at the moment. And that is why in Gauteng specifically, there's now for the next 2 weeks, there's going to be a drive to specifically reach people between 12 and 17. If we look at the population of 12 to 17, about 8% of them have been vaccinated so far. So there's still quite a way to go. So schools are now disseminating forms in Gauteng to get parents to sign them and for kids to then get vaccinated at school. And during the holidays, the festive season, schools will also be turned into vaccination sites. So it's really important that you get vaccinated before you leave for your holidays in December, before you travel, and also to try and avoid large gatherings, because that specifically is where you would see super spreader events. So if we just look at Gauteng and Tshwane, where the outbreaks really started are at universities, because that's where people congregated specifically in the province.
Every expert I've spoken to says they still expect the vaccines that we have to work against the Omicron variant. They'll still give you a very high level of protection.
Well, we don't have clear data yet, but with the data that we have in Gauteng, it looks like they will still provide very good levels of protection against specifically hospitalization. It may not be that effective against infection because we see a rapid rise in infections, but against hospitalization and death, it seems like they still provide very good protection. And if you wanted to get vaccinated, there is a Women Week next week between the 3rd and the 10th of December. and there's going to be a specific drive to get people vaccinated. Although if we look at the past, at Duma weekends, we've never really reached our targets, but we did see a considerable increase in the number of people getting vaccinated. So this time around, there will be prizes for people who get vaccinated, who get one shot before the end of the year, up to 100,000 rands. And there will also be the vouchers that we've previously heard of, the grocery vouchers for people of 50 and older who get vaccinated. That has now been increased from 100 rands to 200 rands.
And people have been preparing, hospitals, authorities have been preparing for severe cases. There's a lot of experience to go on now. They'll also know which treatment works and which treatment doesn't. And I would like to think we have more ventilators.
Well, the modelists predict that the hospitalizations compared for the fourth wave in Gauteng specifically compared to the third wave will be half. Actually less than half of those that we saw in the third wave. So it will be a better number to handle, but they did point out this morning that it's still a considerable number of beds that we would have to look after. Of course, there are antiviral treatments now that can make people less likely to end up in hospital or fall seriously ill, but we unfortunately don't yet have those in South Africa. They also first need to get registered by SAPRA, but I know that there are plans to make them available locally and to produce them locally.
Mia Malam, thank you very much indeed, the Editor-in-Chief at the Baker Cesar Centre for Health Journalism. I do appreciate it.